I talked to an elder whose husband had diabetes back in the 1950s. They went to see the doctor and 2 weeks later got a letter saying his blood sugar was high and to increase his insulin. She said he gave himself an injection of insulin and down he went. Fortunately, times have changed. CGMs, or continuous glucose monitors, continually track your blood sugar and give you accurate readings through an app and a smartphone. They use a small sensor that is attached to your skin, and the sensors last up to 15 days. Some of the sensors are the size of 2 pennies stacked, and they are relatively painless to put on. You do not have to poke your finger to check your blood sugar. The sensor checks it as often as every minute. CGMs have been game-changing for many people with diabetes and have brought many into good control when they weren't before. Not having to poke your finger to check your glucose has really helped those who are afraid of needles. It would be easy to assume that everyone with diabetes has a CGM or has access to one. However, that is not the case, and poorer, older, and those on Medicaid and minorities have less access to CGMs than those with better health coverage. The American Diabetes Association is lobbying to address this. CGMs provide life-changing benefits for diabetes control. They help avoid or delay serious short-term and long-term diabetes complications. They have alarms to help avoid high or low blood sugar episodes. They give patients with diabetes real-time readings and graphs that are simple to read and intuitive. They can give average glucose measurements over different time frames. Again, continuous glucose monitors have been a game changer. They have brought many into better control than they otherwise would have been. CGMs are still expensive, and that's a barrier to everyone who needs one having one. That expense is more than offset by better diabetes control and a decrease in all the complications that come with diabetes. Diabetes affects all parts of the body. I was told in medical school, if you know diabetes, you know medicine. If you have diabetes and you don't have a CGM yet, ask your healthcare provider. If you can use a smartphone to read social media posts and memes, you can learn to use a CGM. You deserve better diabetes control. Remember to call an elder. They've been waiting for your call. I'm Dr. Arnie Vainio, and this is Health Matters.